Now, still on the same note about the rise of positive COVID-19 cases in the capital, Kigali City Mayor Pudence Rubingisa tells us more about, among other things, what is being done about the rising numbers of the COVID-19 cases and why. In the recent past, we have seen an escalating number of positive cases, COVID-19 positive cases in the city of Kigali. Would you say the situation in the city has escalated?
Yes, I would say that the situation in the city has escalated. Last month, we observed the situation in some of the informal settlements that had to go a process of being locked down so that we try to maintain the situation. And then nowadays, we are also observing the same situation escalating in some of the markets, closed markets, where we've seen numbers really going a bit up. Yes, we are seeing these coming up, but there are some measures that we are putting in place to see how we can defeat and contain the situation.
Before maybe you tell us the measures, why do you think the escalation is now, we are realizing an escalation of cases? Why are people becoming complacent, or what has happened that has changed?
From the analysis that we are conducting, we are seeing people becoming a bit, I would say, tired of, complying with the measures. So I think people are just becoming a bit, reluctant to keep moving on, and yet the pandemic is still there, and we don't know how long time this will take. So we should be rather, observing the measures and also owning the process. The police is there, youth volunteers, local government structures that go down there to the Mudugudu level, to the cell. So we should really all together put our efforts together and make sure that things are properly handled, because we are seeing numbers, the curve is really going a bit up.
Yeah, and so what are these new measures that you're going to be putting in place? And what is the special incentive about them that will actually awaken people to follow the guidelines that are put in place?
Well, there is number one is, of course, keep the awareness campaign across the city. This is being handled by different organs. Number two is, trying to map different areas there where we see there is a high risk of people to be to get contaminated. So the high-risk zones have been mapped, and we are enforcing measures by, making sure that we are watching and we are pushing people to observe the measures. Those high-risk zones that have been marked, we again trying to see how they can do things differently to minimize the risks. I can here give an example of the markets that have been seen as a risk. Where we intend to decongest those markets by allowing people alternative places where they can also be able to sell.
I see, but is there like a specific kind of supervision that's going to be happening? Because I mean, all these measures have been in place, but what special thing or supervision that's going to be required for people in the markets? Because even then, when you're advocating for people to wear masks, keep social distancing, we're still seeing people that are still violating these guidelines. What is that special supervision that's going to be happening either from RBC, Ministry of Local Government, Rwanda National Police? And may I ask also, maybe one would wonder, why wait until the situation has escalated for these tough guidelines to be put in place?
Well, we really didn't wait. The situation has always been that we kept following up. And also, as I said, people are feeling that being a bit tired of living with the situation for this quite long period of time. So let's again remind them that we are yet to be there. We still have the pandemic with us. We still have the virus. So don't really, slow down in terms of enforcing the measures. There is this ownership of the process that we expected from each and every one. Now, what is that we're going to do differently? I think the message that we are spreading now, we need to make sure that probably we communicate differently so that even the content of our message is quite different to raise the tone. Number two is, again, increasing the number of inspectors, because we've seen that when people are being told to observe the measures, they can be able to behave. So we need to increase the number of inspectors, youth volunteers, the local government people in those the hotspots that have been mapped, to make sure that actually people don't create the situation, any gap that can be also a cause of spreading the pandemic. Yeah.
Well, many thanks indeed for your time today.
Thank you so much.
Yeah.